Kohli join us today. He was just a part of our panel discussion, and I would like to ask him, sir, what were the key takeaways you think out of your panel discussion?
So, hi, good afternoon. First of all, it's a pleasure to be here, and I must congratulate Voice of Healthcare for a very nicely built panel. They were pretty senior members alongside me on the panel, and it was good to have that interaction with them. I think largely we were talking about how do we get the Indian companies moving, and as far as global pushing them globally, as well as building them up in India. So I think one of the key takeaways that everybody on the panel was pretty much pointing out was that supporting them in going global, which means very recently we've had a MD EPC which has just started a couple of days back. So we are all hopeful that they will come out with initiatives how to help companies go global. Because when it comes to going global, we have a lot of challenges, particularly with certifications. The time which is taking in India to obtain a C certification or a US FDA certification, that is very, very long when you're talking about a class 2B or a class 3, or in Indian terms a class C or a class D device. So I think that's something which needs intervention from the government also, how we can expedite that. Because when we compare that with our neighbors, they pretty much get the entire process done in 6 months, where it's taking us about 3 years to get it done in India. In fact, 6 months is the time which the authorized laboratories or the authorized companies are quoting to. You're taking time to quote us. So cost, of course, is a barrier, but more than that, I think now the time is the bigger challenge that we all are facing. Other than that, the government is now coming out with new schemes to incentivize R&D, the PRIP scheme. So that is still being rolled out, and as we speak, and we are quite hopeful that that should bring in a lot of more domestic innovation, which is critical for medical devices, and particularly life-saving medical devices.
So very wonderful points of the 3 years is very something I think every Indian and company can relate to. Thank you so much for your time, sir.